Well, thank you so much for joining us. Dr. Webb is joining us to talk all things coronavirus and hopefully answer some of your questions. Of course, it's affecting everyone, Dr. Webb, so we thank you for your time sitting down with us to give us some very helpful and valuable advice here. So my first question to you is regarding COVID-19. How at risk are West Texans?
So we are all at risk currently. And I can tell you we are planning as if we are at risk for an outbreak. So we are not taking this lightly, especially with the recent travels, the recent spring break we had, conferences. We are always preparing as if we are at risk, and everyone at home should be preparing as if we are at a high risk.
So this is, of course, an unprecedented event.
True.
Globally. Here in West Texas, do you feel like the medical professionals and local officials are prepared if a case or an outbreak comes to West Texas?
So there has been a community-wide effort at communicating daily, at planning between local health leaders, healthcare professionals, hospitals, schools, leaders in general, in coming together, finding places for screening, closing schools down to prevent outbreaks, educating our viewers and our patients. And planning means having multiple things. Planning means having not only a plan, but also a backup plan, and also having the resources and knowing how to use those in an outbreak. And I can tell you from being in the medical community, we are doing and working around the clock to be prepared for an outbreak.
Now, a big question that I think is on everyone's minds, in West Texas, there are 0 confirmed cases here in the Permian Basin. So how should we be treating this situation right now? Should we be social distancing or self-quarantining?
Those are great ways to keep that number at a 0 if we can. So if you are watching this, it's very important to practice social distancing. We are not saying that for no reason. There has been studies, multiple studies about it, keeping 6 feet distances, staying at home, washing your hands, using a sanitizer if you don't have water and soap available, covering your face with a mask only if you have any cough or symptoms, and trying not to be in social gatherings or in big groups, and in areas where there's a lot of people, and try, if you have any signs of symptoms, please quarantine yourself for 2 weeks, even if you can't get to a doctor, or call a doctor or anybody. So the best thing we can do to flatten that curve is stay at home, follow the recommendations by our leaders and healthcare providers, and try and keep that number at a 0 if we can. That would be great.
Okay, so day to day for West Texans is just stay home. Is that accurate?
Yes, that's the best thing you can do, is social distancing and staying at home unless it's necessary to leave the house for, important reasons.
Right, like go to the grocery store. Is that safe to do?
Go to the grocery stores, but do not go to hoard. Do not go get enough for about 2 weeks supply. Do not go and buy every toilet paper available. I still don't understand that. But get enough for 2 weeks. Get enough of water, enough of meals for your family for about 2 weeks. Always think of the elderly, think of the sick people, think of the pregnant moms, think of the kiddos that do not have the physical and mental ability to go stand and fight people and stand in a crowd and fight for their merchandise. Let's come together as a community to think of others. So yes, going to the grocery store, especially during this time, there has been tons of big crowds, and this is the best place to catch any type of virus, not just the COVID.
Speaking of hoarding groceries, you hear HEB president and CEO saying they have plenty of groceries to stock the shelves, so just get what you would normally buy on a weekly basis.
Exactly.
Do you think that the fact that people are hoarding their groceries is a sign of panic? And what does panic do to our community? So
panic will destroy our community. Panic will cause more destruction, honestly, to our community. So we do need, again, to come together to help each other out. Do not panic, like the HEB personnel said, that we do have enough, but when somebody goes and buys in bulks, then that's when we have an issue. We are trying to be prepared to prevent a disaster from happening. So being panicked is only going to make it worse. And let's come together as a community, because as a community and helping each other out, we can get through this. But if we break, then it will be a lot harder to do so.
Right. So best case scenario, how should our viewers be handling this pandemic?
So if you're watching, the best thing you can do again is stay at home. If you have to leave the house, or if you're around anybody, always wash your hands, do not touch your face. If you're sick, please quarantine yourself for 2 weeks. If you do feel like you have any signs and symptoms, which they can be very vague because they can be symptoms same as common cold or flu, call your physician, or we will provide a number that you can call as well. Do not rush to the ER, do not rush to the hospital, do not rush to your doctor's office. Instead, call them so they can tell you where to go. A lot of time we're doing screenings outside the offices, outside the hospital, to prevent others from being, because I mean, in the hospital and clinics we have a lot of sick patients waiting, a lot of kiddos, so we're trying to prevent the spread. So always call before you go there so we can tell you what you need and what you don't need to be doing.
Right, and Dr. Webb, we talked before we sat down that you are in family medicine and you're still having a lot of patients come in. Let's turn now to testing. So is there testing being done right here in the Permian Basin that you know of, and how much is being done?
So we do have testing. I know, knowing from family members and friends, they're all scared and freaked out, saying we don't have enough testing. We do have the testing. I can guarantee you that. We have certain guidelines we have to follow. I do see it in the past 2 days in my clinics. Patients will get upset because they are not getting testing. They're calling all day, every day, because they want to get tested, and we do understand their fears. We have the same fears. We have patients and families with the same symptoms, but we have to follow the guidelines. If you are not immunocompromised, if you're not an elderly, if you are in a good health, even if we think you might have it, we will direct you over the phone. Even if you don't qualify for screening, we will tell you what to do. So listen to your healthcare providers. And yes, again, we do have screenings. We are screening the patients that we think are at risk or at high risk.
And that's just questions, right?
Yes.
A series of questions. So if your immune system's not compromised and you're not 65 and older or in the front lines of healthcare, you will not be tested because you're not a priority?
That is not true. So the testing, we do have testing, but we are using, until we have tons of testing like the flu, we cannot just go and test everybody. Right. We do not have the means to do so. It is limited supply. And at the end of the day, the treatment is the same unless you are immunocompromised or you have severe symptoms. So the treatment is always quarantining yourself in a house or in a hospital.
Right, so if someone does call you and want to test but they can't get it just yet, what is your advice to them? To just stay home if they think they have it?
Stay home by yourself, have a quarantine room, get your supplies sent to you, and do not leave your room for at least 2 weeks.
All right, so let's talk COVID-19 specifically. How does this virus spread?
So it is air droplets. Air droplet. It could also stay on surfaces for a amount of time. So it is very important to always cough in your sleeve or have a mask if you're sick. If you touch surfaces, always wash your hands and use hand sanitizers. Always wipe down surfaces that you've been around. I do that all day with my stethoscope, with our desks, with our patients' room, so just to avoid somebody else catching it.
Okay, and what are the symptoms of COVID-19?
So that is the bad thing about COVID, is we don't have one specific symptom. It could be very vague, such as the cold and the flu. It typically starts, from what we know from studies, with fever and cough, but that doesn't always happen. You could have the cough with a low-grade fever or with no fever, but the most common symptoms are kind of like the cold: cough, flu, cough, fever, sometimes, and shortness of breath. That's been one of the main ones as well. It does not typically happen with sneezing. We have not seen that, but the general ones are cough, shortness of breath, a little bit of runny nose, and fever. And
you hear from some healthcare professionals that it can be asymptomatic for a long time. So, you know, if you don't know you have it, it can spread a lot quicker.
Exactly, and that is another thing I was going to say is that's another danger of it, because in a lot of healthy individuals it might be asymptomatic, and that's why social distancing is very important this time. Staying at home and listening to your local health leaders is very important, and following those directions. Just because you feel good about yourself doesn't mean you might not have it, doesn't mean you can go out and be in the public.
So here locally, what are the resources that we have here in West Texas to help fight this pandemic if cases were to come here? So
we do have places to screen, which is great. We also have so far the resources such as the PPEs for the doctors, the MAs, everybody in the healthcare. So another reason why I tell patients, do not go buy every mask you can find, because people in the front lines are going to need them more than you if you're not having any symptoms. We have the areas, we have the ventilators. We are prepared for an outbreak, but it would help if we can contain it before it spreads.
So flatten the curve here is what I'm hearing is the key to this. The federal government today saying that this could last through August. The U.S. dealing with this pandemic. Here in West Texas, you know, how are we going to be able to overcome this? And will that last through August, would you anticipate?
Well, it is, I mean, we're always anticipating the worst. If we're prepared for the worst, we can kind of battle anything. So if in our head we think of the worst, if we find a solution before that, is great. But again, being proactive at prevention is very important, and listening to our healthcare leaders, listening to your physician, and following the directions that we've been providing on a daily level is very important, because we as well are learning as we go. We're learning from what happened in China and Italy and trying to correct those mistakes, or trying to be one step ahead of what is to happen.
Right. Okay, and let's go back to the virus itself. So if someone needs to, you know, if they think that they have symptoms and they want to get tested, so the first thing they should do, right, is to call.
Yes, so call your provider. You can even call the ER, and they will give you the information. They will go through a questionnaire, a list of questionnaires, to see if you do fit the criteria to be tested. There is a number, I think we wrote it down, yes. If you do not have a provider or do not know where to call, 432-582-8030. We'll do a phone screening, and they will tell you the right place to go and where to get tested.
Because it's so infectious. So if you think you have it and you rush out of the house to the ER, which we normally would do if we are sick or ill, you know, or a broken bone, that's just going to spread it.
Exactly.
More so. So they're saying to stay home, be calm, call your healthcare provider first, or that number there, and get your instructions from them on case-by-case basis, depending. Okay, and what have you heard about a potential vaccine for COVID-19?
So there has been a lot of studies, even knowing friends that work in the scientific or the chemical part of it. I know there's a lot of work on vaccines. I know there was one that was possibly started to be tested and used with on Monday. Obviously, everything is still in the work in progress phase, so we don't have a definite answer yet, but I know there has been a lot of work on vaccines and treatment.
Awesome. And the president a few days ago in his news conference talked about drive-through facilities to get testing. Target, Walmart CEOs were there speaking with the president. Do you think those drive-through facilities will be coming to West Texas anytime soon?
Honestly, that would be great. Again, I have heard of a lot of drive-through healthcare facilities that are doing that. For example, we're even as physicians in West Texas, we are trying to test. We have been testing, or if we do test a patient, we are trying to do it in their car outside the clinic, so they don't come and expose our patients. So I think that would be an amazing thing if we can make it happen. Sure. Okay, well, Dr. Webb, we know you are very busy. We appreciate you being generous with your time and stopping by the Big 2 News studio to answer some of our questions today. So thank you so much, Dr. Webb.
We appreciate it.
Thank you.